Alright, we're going to wind this little video series on the appendicular skeleton down by talking about the pelvic girdle and the bones of the lower extremity until the tarsal region, until the ankle region. And then the last video in the series is going to be tarsal region and the bones of the foot. Okay? So, the pelvic girdle, like I told you before, a girdle is a bony structure that attaches a limb to the axial skeleton. The inferior girdle is also called the pelvic girdle, and it's made of these two interesting and irregularly shaped bones that share a joint with each other anteriorly and a joint with the distal vertebral column posteriorly. Okay, they share a joint with the sacrum posteriorly and a joint with each other anteriorly. And I've just got one of them here in my hand, but a single one of these hip bones or pelvic bones is called an os coxa, O-S-C-O-X-A. Okay, it's called also a pelvic bone or a hip bone. Okay, this is a right os coxa, and I'm going to show you why. The important parts of this structure, first of all, are going to be the three major regions of this bone. Okay, there is, first let me orient you. If you look at a person in an anatomic position, you're going to see the bone like this. Okay, this is anterior, lateral, and posterior. Okay, if you look at this bone from a lateral view, you're going to see a large cavity or crater there. As you can probably guess, this is the site of articulation of the femur. Okay, and it goes lateral. And then, if you can imagine the pelvis as this bowl-shaped structure, you can get the sense that this that the bone contributes to the right side of the bowl. If you put it laterally, well, that's not a good example because the other way looks similar to it as well. Okay, I'll tell you the other clue is going to be a posterior structure. Okay, so I gave you the big lateral structure, a posterior structure, this really prominent notch that goes to the back. Okay, so now you've got a posterior and a lateral structure. That tells you, when you hold it in the anatomic position, this is a right-sided bone. Okay, it has a left-sided partner that's a mirror image of it. When you look at this from the lateral view, it's not something that you see with the naked eye, but there are three regions of this bone. Okay, there is an inferior and anterior portion of this bone. It's called the pubic bone. Okay, and that's where I'm tracing my finger here. There's an inferior and posterior aspect of this bone. It's called the ischium or the ischium. Okay, and then everything else, this superior, large wing-shaped part of the bone is called the ilium. Okay, ilium means wing. So the pubic bone forms a joint with the left-sided pubic bone at an area called the pubic symphysis. Okay, the symphysis is the joint, the anterior joint of the pelvis that joins the right and left os coxa together. Okay, it contributes to the anterior portion of this ring. On the posterior part of this ring, this is the ischium. Okay, this most posterior and inferior aspect of the ischium is called the ischial tuberosity. This is what some people call the butt bone, or if you've ever heard someone has a bony butt when they sit on your lap or something, and what you're feeling is the ischial tuberosity. And that's a little bit of a crass or crude way to describe it, but I mean, I'm just trying to tie things to something you may have heard. Okay, that's the ischial tuberosity, and together those two bones with the inferior part of the ilium form this ring. This ring is called the obturator foramen. Okay, there's a membrane, muscle, and large vessels pass through this, and I'll point those out later on in the unit in this semester. From a lateral and posterior view, you can really see this prominent notch. Okay, there's no notch on this bone that's as prominent or large as this notch right there. It's called a greater sciatic notch. It's posterior, and in fact, it's posterior and oriented a bit medially. So really, as this bone lies, the greater sciatic notch comes in like in in that direction. I told you about this large crater-shaped cavity. Okay, this was the socket of a ball and socket joint between the pelvis and the femur. Okay, this is what makes this thing the pelvic girdle. This is where the appendicular skeleton of the lower extremity attaches to the axial skeleton. It's really right here. Okay, and this crater-shaped structure is known as the acetabulum. Acetabulum means vinegar cup. Acid like acetic acid or vinegar, and tabulum means cup. So this is how the femur rests in this joint. You can see it's got quite a bit of range of motion, but nothing like the upper extremity. This is a strong, stable, weight-bearing joint. Okay, the lower extremity. When you look at this bone from the side, you're going to see, this nice crest. This is the iliac crest. Okay, and then if you look anteriorly, and posteriorly, you're going to see these spine-like projections here. This is the anterior and superior iliac spine. And this is the anterior and inferior iliac spine. Okay, there's also posterior iliac spines. The medial bowl-shaped part of the ilium is called the iliac fossa. And there's an interesting clinical correlation I'll tell you about in class, but this is where a transplant kidney resides after a kidney transplant, okay? And the other failed native kidneys stay put, okay? What else in this bone? I think that's everything on the list. I'm using my tablet to record it, so I don't have the list in front of me. Okay, let's move on to the lower extremity bones, okay? Next bone distally is going to be the femur. Okay, this is the thigh bone. This is the largest, most substantial long bone in the body. Okay, the first thing on the list, I believe, is going to be the head, the femoral head. Okay, this is the smooth, round, articular surface that fits into the acetabulum, and the medial part of the head has this pit or depression called the fovea. Okay, fovea is a small pit or depression. There's a ligament that goes in there and it attaches the femur to the inside of the acetabulum. Okay. Just like in the humerus, there's a neck. There's a neck between the head and the rest of the bone. My fingers are around it right now. This is the neck of the femur, and the neck separates the head from the two trochanters. Okay, the trochanters are these projections that are attachment sites for muscles and whatnot, and I'll tell you more about that later on, but there's a lateral greater trochanter, and a medial and somewhat distal lesser trochanter. Okay, greater trochanter, lesser trochanter. And then the distal aspect of this bone has a smooth patellar surface, and just like the humerus had epicondyles, this bone has a medial and lateral epicondyle. It's got as well medial and lateral condyles. Recall that a condyle is a smooth, rounded articular surface. And on this bone, there are these two smooth, rounded articular surfaces, just like the occipital condyles of the occipital bone in the skull. Okay, these two surfaces form a really nice and complex joint with the tibia of the lower extremity of the lower leg, which also has medial and lateral condyles. And then hey baby, hey big baby. And then the space between the two condyles, the intercondylar fossa, is the best clue to figuring out the anterior and posterior side of this bone. The intercondylar fossa is posterior. Okay, so my finger's in the intercondylar fossa, but I'm showing you the anterior part of the bone. If I flip it around, you're going to see the intercondylar fossa is the fossa between the condyles. Okay, so this is anterior. This is proximal. The head of the femur goes into the acetabulum of the pelvis. Okay, so that tells you that this is going to be the lateral and the medial condyles, and this is the lateral and medial epicondyle. Remember that epi means above or on top of. So the epicondyles are on top of the condyles. Lateral, medial, distal, proximal, anterior, posterior. On the posterior aspect of this bone, there's this more distinct and sharp line called the linea aspera. And I think that's going to be all the structures of the femur. Tibia is the T-shaped bone of the calf. Okay, it's the medial bone of two calf bones. Okay, and it's the weight-bearing bone. It's the more substantial, it's the more sturdy bone. This contributes to the knee joint. Its partner in the leg does not articulate with the femur. It's not really part of the knee joint. That's the fibula. This is the tibia. T for tibia. Okay, the T here is proximal. Okay, and just distal, there's a bump or projection here called the tibial tuberosity. This is an anterior structure, and there's a sharp anterior tibial crest. These are anterior structures. Okay. Most distally, there's a projection of the bone that extends more distally than the other side. This is a medial structure called the medial malleolus. And if you know all of those things, then you'll see that you're looking right now at the left tibia in the anatomic position. You're looking at the anterior and the medial malleolus. This is the left-sided tibia. Okay? The fibula resides laterally at the tibia, the weight-bearing part of this bone, and its most distal projection is medial. You can feel this on yourself as that medial ankle bump that loves to get hit on the dishwasher and the bed frame. Okay. If you look at this bone from the superior, you see lateral and medial condyles, just like in the femur. Okay. This then forms the knee joint along with the femur. Okay. Lateral and posterior aspect where my finger is now, there's an ulnar notch. I mean a fibular notch. Sorry, fibular notch where the fibula sits. Okay. The fibula doesn't articulate with the femur. It's not a weight-bearing bone. It's much more delicate and thin. It's not as substantial and strong. All right, this is a site for muscle attachment, and it contributes to the calf, but it's not weight-bearing. Okay, it's not attached with the. Is not articulated with the femur. Okay, so there's a head of the fibula. Okay, is the proximal part, and an apex. Okay, distally, you'll notice that this bone also has a lateral aspect that extends more distally than the medial aspect. Okay, this bone is lateral in the leg. Okay, the apex is up and lateral, superior or proximal and lateral. This is the lateral malleolus. You can feel it on the lateral or outer aspect of your ankle. This is the bump frequently hit on things. Okay, so this is a left-sided fibula. Okay, so that's the lower extremity from the pelvic girdle through the tarsal region. Okay, and next video we'll talk about the tarsal region in the foot.